Hello everyone, welcome to ENT students. So today I'll be talking about impedance audiometry. Impedance audiometry is an objective method based on the measurement of the pressure in the middle ear, stapedius reflexes and tension of the tympanic membrane. It is one of the most common and most accurate methods for testing the middle ear. The purpose of impedance audiometry is to check the status of the tympanic membrane and middle ear. It checks how well the vibrations get transmitted from the tympanic membrane further into the ear. It receives sound vibrations from the atmospheric air and transmits them to the tiny bones in the tympanic cavity. The other purpose of this test is to evaluate acoustic reflex. The acoustic reflex is an involuntary contraction of the stapedius muscle in response to loud sound stimuli. The reflex is often used to evaluate facial nerve functioning. So, the test is performed in the following way. It is completely painless and non-invasive. The operator inserts the probe tube into the ear. The entire arrangement is in such that entry of air in your ear remains completely blocked throughout the test. Tympanometry measures the pressure in the middle ear while the operator changes the pressure in the ear canal. Stapedius reflex test is used to measure the sound tolerability of your ear. Your ear is exposed to middle and high frequency stimulus sounds. The test will check whether the contraction of the stapedius muscle is present at a particular frequency of sound. So this is the instrument used for measuring the impedance. Eustachian tube patency or functioning test checks how much the eustachian tube is open. The operator will ask you to swallow several times or yawn to check if the eustachian tube can clear the pressure. Several types of this test exist. Some of the types help evaluate the efficacy of treatments to improve eustachian tube dysfunction. The result of the impedance audiometry is a graph known as a tympanogram. The tympanogram shows values of the intensity of acoustic reflex on the frequencies 0.5, 1, 2, and 4 kHz. So this is how the probe is inserted into the ear of the patient. So these are the different types of tympanograms. There are 5 types of tympanograms: type A, type B, type C, type AD, and type AS. In type A tympanogram, the middle ear pressure, compliance, and volume of the middle ear cavity are normal. In type B, the volume is smaller than within the normal range. In type C tympanogram, the middle ear pressure is more negative than minus 100 Daltons, and the compliance are the volume are normal. In type AD, the middle ear pressure and volume are normal, but the compliance is greater than 1.6 ml. And in type AS tympanogram, the middle ear pressure and volume are normal, but the compliance is less than 30 ml. The diseases which need diagnostic by this test are otitis media, perforation of the tympanic membrane, middle ear effusion, flu ear, that is collection of thick and sticky fluid in the ear, eustachian tube dysfunction, which is the inflammation of the eustachian tube making it unable to close or open, otosclerosis, that is abnormal remodeling of the stapedius, fracture of ear bones, and facial palsy. Thank you.